Welcome to You're Such a Great Listener. This is our first book review podcast. And this month we are reviewing the Bad Therapy, Why the Kids Aren't Growing Up by Abigail Shrier. Rachel, you want to tell us why you picked this book to be our first book club book?
So I'll be honest, I was asked a number of times, have you read Bad Therapy and what do you think about it? And I hadn't. So I went to my library's website to go and place an order on it. And usually I can get books in a day or two. We have an amazing public library system. And there was a hold on it. I obviously was not the first person interested in Bad Therapy. And then I went to Amazon and I noticed that it was the number one bestseller in the parenting section. It came out earlier this year in February, and there were over 1,000 reviews, 4.6 out of 5 stars. And I was like, I guess I have to read this. And I'll be honest, when it arrived, I was thinking like, oh, this is probably by a psychologist, a social worker, a mental health professional, and opened up the book jacket. And lo and behold, it was a piece by an attorney who became a journalist. And, in doing a little bit more research, learned that she had published Irreversible Damage and had really been on the speaker circuit. So I now understand why I was being asked, have I read this, and why and then we were talking about how do we want to start our book review, and I thought it was just something to be timely. It's summertime, kids are home, we're home. The structure of the school year is not necessarily there, whether you're already thinking about back to school or just in the nitty gritty of parenting in summer. It just felt like a timely book to read, whether you agree with everything or not. As a teletherapy practice at TheraListen, we are offering therapy, and we're offering therapy not just to adults, but to parents and adolescents. And why the kids aren't growing up is something that I think anyone who is raising children or kind of navigating that emerging adulthood phase has heard about. And this is definitely in the news and in the media, and honestly being read and reviewed.
Yeah, I definitely had clients coming into my office also saying, Orly, have you read this? And I was like, I have not read this. I actually hadn't even heard of it at that time. This was many months ago. But
Yeah.
I think that part of the reason why I hadn't heard of it at that time was because it wasn't coming from a clinician. It was coming from a journalist perspective. And I think that gives it a little bit of a different feel, and also why it might not have been on my radar.
Right. And as I was preparing for this and really thinking about it, I was, it felt like a lot of interviews. It felt like some research, but almost like reading a 60 Minutes episode, meaning like it was a fun read, an interesting read, and definitely something different that I might not normally be thinking about, because as someone who has been in mental health for so many years, I really do believe in therapy. I really do believe in great therapy. And I know great therapists, and I work with people every day whose lives are changed for the better because of therapy. And at the same time, it made me think. It made me think about what is best practice. What are people thinking about what we do as professionals, and what might be some of the stigma. And that's really was my takeaway. What is some of the stigma around therapy, and like how can we as mental health providers really represent some of the misrepresentation?
So let's rewind a minute, because even though tons of people have read this book, the people who are listening to this podcast might not have read this book.
Yeah.
So what is it about?
Okay, so I found that the chapters were really helpful, and it was organized really clearly. Part one was about the potential harm of therapy, right? Which was an interest as a therapist. It was an interesting way of opening up, where she really does, kind of think about the fact that therapy, of course, is necessary for people who really need it. And that's the author's note, that, of course, medication and mental health care is essential for people who need it, but that she doesn't necessarily feel everybody needs it. And in fact, if you don't need it, that it can be harmful. And then the book really goes through a number of different chapters looking at different issues that youth are facing today, that families are facing today, including challenges, what happens when therapy isn't right. She looks at the toll of bad therapy, that it can be more harmful than helpful. Thinking about DSM diagnoses, having clinical diagnoses that are not necessary for regular childhood experiences, as well as almost like a critique of gentle parenting, of not having corporal punishment, not spanking, not having consequences, not having structure, and that gentle, caring, attachment-based parenting that so many of us are striving for today is almost creating a type of child that is not resilient. And spare the rod, drug the child was one of the chapters that really, struck a chord with me, that, are we pro spanking? Are we anti meds? Or have we learned from, generations of past that parenting is about balance? She writes about the professionalism of parenting, that, and that, it's not just a relationship anymore. And I really wonder, what the organization of the book is. It kind of, for me, it was about, almost like a criticism of modern parenting, of mental health care, of medication management. And yet at the same time, she made some really important points about challenges that parents and educators, and I think anyone having anything to do with little people today, are struggling with.
So overall, if you had to give it out of 5 stars, what would you give it?
Oh, wait, I'm not sure. What about you? How would you summarize it before because
how would I summarize?
To be honest, I read it a while ago when it first came out, when I was being asked, and I kind of had it sitting on my bookshelf. And revisiting it, it really resonated with me. There were parts of it that really resonated with me, but there were also just some lines and some parts that I just found provocative and unsubstantiated. So I'm not sure. What about you?
Yeah, so I had a very similar feeling. I was reading this book and I was like, oh, this is a woman with an agenda. This is not a woman who went into this with an open mind to see where things kind of take her, but she's trying to argue for something. Now, I have a lot of understanding for what she's trying to argue for. I think parenting is really hard these days. I do think that, the points that she makes about parents having ceded their authority to all sorts of other experts, I think is really true. I think we see a lot of parents who are concerned and cautious about stepping into their own authority. Not just authority as in power, but like authority as like, this is my kid. I've been with them since day one. I know what's going on with them. I know what they need. Right.
I think parents trusting their parental instincts.
Yes.
That like attachment based parenting, that like, I've known them since they were little people. Trust me here.
Yeah. Mm-hmm. So I really understand her wanting to promote that. And at the same time, some of the things that she says about therapy, some of the things that she says about medication, I've seen medication be really transformative, not in a way that like it becomes a crutch, but in a way that it really becomes a tool and allows an individual to flourish. And so, it's hard for me to rate the book also. On the one hand, I want to give it, 4 stars because it's really, really thought provoking. On the other hand, I'm concerned that if I give a book of 4 stars, you're going to go read it. You're going to think that everything in here is worthwhile and meritorious and true. And it's not. It's kind of, thought provoking, and you should read it because it's thought provoking, but you should not assume that she knows what she's talking about.
Right. And something that, as you were describing, the mixed bag here is that there's also a downside to not having medication and not having therapy. And how do we evaluate risk as parents, as educators, as grownups? We know, that one of the pieces that stood out to me is a story she talks about of a child in Israel who was diagnosed with ADHD. And as someone who's worked with ADHD kids and grownups for 15 years, I see where she's coming from. Behavior management is a really effective tool for managing ADHD, but we call it behavior therapy. We call it that is cognitive behavioral therapy for executive functioning, and that's evidence-based practice. But depending on how you market something, it could be behavior management from a parent, but it can also be a skill toolbox that can be taught in schools by educators and reinforced by parents. Absolutely. And there's also sometimes a cost of not taking medication, like not necessarily for a 4-year-old and for anyone who's worked with neurologists or psychiatrists in the pediatric space. There's a lot of caution around medication at this point. And that was a little flippant for me that, you either medicate or you don't. Well, you could also wait and see and evaluate the risks and evaluate the benefits with your prescriber and really working with a mental health professional to find that right prescriber. And that level of nuance I felt was missing. And, and how you frame therapy, there was one section in the book that kind of almost mocked an incoming college student interested in developing and working on her social skills before college. I actually would applaud the family and the young adult who is thinking about how do I navigate the transition from high school to college really effectively? How do I plan? How do I think about my activities of daily living? How do I think about work-life balance, about figuring out when and how to make the right friends so I'm setting myself up for success in college? That to me is not something to necessarily mock. And at the same time, there's lots of different ways of approaching therapy. Some of it can be preventative, like in the space of incoming college student preparing. And we know about the slippery slope that without the right supports, people who might be the worried well, which is kind of what she's describing in the book, could really decompensate, that could really be struggling. And why wait for someone to really be down in the dumps and really struggling if they can get time-bound, effective, evidence-based treatment? And that's, I think, for me, something that has resonated as a therapist. Our goal in therapy is not to have lifelong treatment, right? Like the almost like the stigma of the analyst. Like, I don't know any children who are lying on a couch, which is kind of the description of a child in analysis. If anything, it's parent-child interaction training. It is behavioral therapy around, a time-limited number of sessions to really develop skills, practice them on your own, and come back if you need some maintenance. But that this almost like antiquated version of therapy is the norm didn't resonate, didn't speak to me.
Yeah, I tell people all the time that we're in a really unique field because we're in the only field where we don't want our clients coming back.
Right.
I don't think of it as a success if a client has been with me for 3 or 4 years. I may enjoy the work that I'm doing with them and I enjoy seeing their growth, but ultimately I want clients to get better and feel competent at handling life on their own.
So what would you consider like successful therapy? And that did come up in bad therapy. Like, how would you describe at Theralisten in your own practice historically, how would you describe like successful therapy?
I think successful therapy has an end. I think successful therapy gives clients a tool or multiple tools to cope with the challenges of life that will come up. And I think that successful therapy is clients feeling empowered to advocate for themselves and make the changes that they want to see. Sometimes a client will come back after a long time and be like, oh, something happened in life. And I need therapy again. But I think that their ability to cope, like, they'll come back after 5 years or something like that, right?
Yeah.
Did nothing challenging happen in those 5 years?
Right.
Not at all. It's that they learned the skills in therapy that they were able to handle it. And then when they realized that there was something and they maybe needed a tune-up, or we call them boosters, right?
Yeah.
So then they come back, but it doesn't, have to be this really long process.
Right.
And I think especially as therapists and as an insurance-based practice, that's something that we always have to be mindful of, right? That clients that are in therapy at Theralisten have a medical necessity for being in therapy. It's not people who want to like navel gaze and explore the trauma of their childhood and that,
or 6 years. Yeah.
Right.
Yeah.
There's a problem with their functioning. They're not able to cope with life, or they're not able to get through their daily life adequately. And so we have therapists that are able to help them function better, and feel better.
And that's also drawing on evidence-based practice, right? And best practices, like, something to really think about. And when you are coming to a practice like Theralisten or going to a licensed mental health professional, that there's ethics here, and there's a commitment to best practice. And one of the things that I kept on thinking about and while reading Bad Therapy is that therapy is not in lieu of friends. It's not in lieu of family. It's not in lieu of community. In fact, like, effective therapy helps you feel more connected to your loved ones. It helps you feel that you are capable of being more of a citizen, meaning that you can go to school, that you can go to work, you could do it really successfully and have happier, healthier, more meaningful relationships, and that it's not in lieu of a support system. Something that I think about a lot is back when I was training at a clinic, I met with someone who really was super isolated. He was a college student, he was struggling. And over the course of just a few months, he went from being unemployed, dropped out of college, to finding a job, finding housing, reconnecting with college friends. And it started with little steps. And we did something called behavioral activation, which is scheduling in showers, scheduling in where you're going to eat, when you're going to exercise. And it very quickly evolved into finding a job, keeping a job, and changing his life in such a short amount of time through the support, but really through empowering him to trust that he's capable. And yes, there might have been medication management. There might have been family that was there for him and friends that were cheering for him. But it all came together through his desire to work on himself, and that therapy isn't there to change you. It's there to support you, empower you, and use research-based tools, evidence-based practice to really get to the finish line sooner than later.
Yeah, definitely. I also think that, as you're saying that, it kind of brings up some of what she was saying, where, like, in her rebuff of gentle parenting, right? That this idea that we can fix everything, we can make everything smooth for our children so that they'll never have a challenge. And that really, that's not the goal, because humans have challenges. Life is challenging. And so similarly, like when you're in therapy, right, the goal is not that, you're never going to have anything bad happen to you in life, right? Things happen. The goal is that you end up getting the skills that you need. And I think that when I specialize in maternal mental health, when I work with parents, there is that temptation, like, if I'm a good parent, nothing bad will happen to my child, right? We just don't control that. We don't control what happens to our child, right? So if you set that as the standard, you will always feel like a failure, because things are going to happen. And rather, what we need to be doing is thinking, am I preparing my child? Am I giving them the skills and the tools that they need? And then also a recognition that children come in all different flavors.
Yeah. Yeah.
So it's really nice to write a book that targets, neurotypical children and children who are not confronted with certain challenges early in life. And then to say,
privilege, right? That this is privilege. Going
yeah,
to schools where there's social emotional curriculum, where there is a host of mental health support staff. Yeah. Yeah.
yeah. And so to like criticize kind of all of parenting and paint it all with the same brush, we're not all starting in the same place.
You almost touched on a piece in the book that I'm still thinking about, and that's really the role of trauma.
Mm.
I've taught trauma to doctoral students and have worked in trauma spaces on and off for years. And something I really focus on as a trauma informed therapist is post traumatic growth. And in the book, you read about theories of trauma and, capital T and lower T. But what was missing was that space on resilience and the research by Tedeschi and others on how do we support our clients and ourselves to be resilient, to grow after a trauma. And so much of the work that I do and that I know my colleagues do in therapy is really supporting that post-traumatic growth so that you don't leave a situation feeling more broken, but you have leaned into your vulnerabilities and found your internal strengths. And that's whether you're a 6-year-old or a 60-year-old, and figure it out what you need to be able to live a more meaningful, mindful life after something bad has happened.
Yeah, she kind of almost makes it really binary.
Yeah.
Like either you experience something traumatic and you're fine, you'll be fine, or you experience something traumatic and you go to therapy and you sit there and you talk about it and they make you believe that you have PTSD.
Right.
And that's really not the role of therapy
Right.
At all. And it's true, I think that, the often the response to trauma is resilience, and people learn how to integrate the trauma into their lives. But one thing that struck me about her book also was like, what were her kind of metrics of success, right? To look back at previous generations and to say, look at all these traumatized people and how they did fine.
My grandmother on my mom's side, my grandmother on my dad's side, my own childhood, that ethnographic piece. Yeah.
Yeah. And like, look at all of these people and they all did fine in life, right? And like, okay, I mean, yes, they did fine in life, but
could it be better? Yeah.
I mean, not just like it could have been better, but I wouldn't, having been raised by people who went through a lot of trauma in their lives, I would not say that they were fine. I would say that, yes, they were paying the rent and yes, there was food on the table, but I would not say that they were fine.
Right.
And I think that there is, if we're just going to look at it like that, can you pay your bills? And do you have food to eat? And is there a roof over your head? These are necessary. I mean, hierarchies, Maslow's hierarchy, right? Like these are necessary things for being okay, but they are not the be all and end all of being okay.
And as you talk about hardships, and we work with people who have experienced the gamut of things, right? Like vulnerable population, is an umbrella term, but really so many of us experience everyday vulnerabilities, and can we be more resilient and lean into coping skills, right? Like thinking about that transmission of trauma that might happen, right? How do we use coping skills to break the cycle? How do we maybe parent differently and not pathologize, maybe not corporal punishment, right? Not spanking, not yelling, not screaming, but also find balance in having structure and expectations and in the conclusion, she talks about removing the spoon. And I and I'm just going to read it because I think there is a very meaningful takeaway from also empowering our kids to be resilient, like our past generations, and maybe finding a balance, and maybe the takeaway from bad therapy is it doesn't have to be all or nothing, and that we can walk away with something. Remove the spoons, the technology, the hovering, the monitoring, the constant doubt, the diagnosing of ordinary behaviors as pathological, the psychiatric medications you aren't convinced your child needs, the expert evaluations. Banish them from their lives, everyone with a tendency to treat your children as disordered. You don't need them. You never needed them. And your kids are almost certainly better off without them. Having kids is the best, most worthy thing you could possibly do. Raise them well. You're the only one who can. And I think that it is meaningful. I think it's meaningful to think about more intentionally our parenting, our practice, the role of technology in our homes, right? And at the same time, I don't know if I agree with a lot of the suggestions that therapy is inherently bad, that there aren't risks of not engaging in therapy for the worried well. And yeah, I feel really conflicted. I'm ending with liking the conclusion, but conflicted about the process.
Well, I mean, I would even caveat the conclusion, right? Because in the conclusion, she says, throw out the medication and you never needed it. And I really understand the hesitation, especially when it comes to children. And I think that that's one thing that she has a little star at the beginning of the book, but she doesn't really address enough, in my opinion, that like what she's saying about children, for starters. But I also think that, people aren't just willy-nilly putting their kids on medication. All the parents,
the flippant nature of
are really thinking about it carefully.
Right.
And all the prescribers are also really thinking about it carefully. Are there more kids on medication than strictly need to be on medication? Probably, yes. But to write a statement like every parent ever never needed medication to help manage their child is buying in the premise that you need to manage your child.
Yeah.
I don't think parents are trying to manage their children. I think they're trying to raise their children. I think they're trying to give their children tools. And I think that it's naive to pretend that we're just trying to put a Band-Aid on things and get our kids to shut up and stop whining and whatever, right? Like kids who need these medications, they need them.
Right.
Not to make our lives easier, but to make their lives capable.
So next month, how do you feel about reading Anxious Generation by Jonathan Haidt? Because he almost picks up where we're talking about the environmental factors, what can be in our control, and makes really concrete suggestions for parents, for individuals around being an anxious generation and not pathologizing it, but really looking at it in a much more holistic way.
Sure. And I would say if anyone is watching and they read Jonathan Haidt's book and they want to have us discuss a certain aspect of it, let us know, drop a comment, and then we can, have some interaction in our conversation.
Thank you so much, Orly. This was great.
Yeah, amazing. See you next month.